longitudinal strokes, so working with the muscle fibre direction, and we've got transverse strokes, so we're working across the muscle fibres, strumming like guitar strings, and it's those transverse strokes that we're looking for restrictions. Okay, so warm the muscle up, spread the lotion, and then we're going to go back. Maybe some pull-throughs work well. So what I'm doing is just applying the pressure down, slowly letting those fibres pass through my fingers, and we're looking for anywhere that we spot any particular speed bumps and restrictions. So they're really clogged up and they force you to kind of lift up a bit so they can pass under. So when you find those, and we will get some around the top of the vastus lateralis, just there, right between vastus lateralis and rectus femoris. Okay, so you can palpate, you can feel the separation of those two muscles. And when we get near the top, we're going to go across transversely. And find an area that's a bit unhappy, a bit restricted, so I think there, yeah. So what we're going to do is apply a bit of pressure, quite specific pressure, so it might be the end of a fingertip, knuckle, maybe an elbow, I'll spare you that tough. We want to reinforce, so I'm actually going to go pads of fingers, reinforce with the top hand, and then we're not going to move over the skin. Okay, we're going to stay where we are on the skin, and just work backwards and forwards, feeling those muscle fibers pass underneath our fingers. Feel okay?
Well, it hurts a bit.
Okay, and like I said, that's inflammatory. So in some cases what that will do is it will kick off that soft tissue injury healing again from the kind of acute phase. But we're also thinking about getting in between those different layers of connective tissue and separating things out and keeping them moving. Generally what we're going to do is aim for the middle of the muscle belly. Okay, so tibialis anterior, for example, that's the middle of the muscle belly right there. Everything from there is bone and everything from there is tendon. Okay, so work your way through, feel for restriction. If you feel some, you can get in there. We're not moving over the skin, so this can be done through clothes as well with very little oil. And let's see how they get on. Don't spend any more than about 2 or 3 times 10 seconds in that area before you move on.